Hi friends, this is Dr. Vijay, Faculty of Medical Oncology from DocTutorials. This is for the Rankers Meet of NEET SS 2025. Here are our achievers of this NEET SS. Let's hear from them their introduction.
Hi, I am Prem Kumar. I completed my MD General Medicine from Ramesha Medical College, Kakinada, and I was secured a rank of 6.
So why medical oncology?
Real motivation is my mother is a breast cancer survivor. So.
Right.
So from those days I wanted to pursue in the medicine department or in the subspecialties of medicine. My interest was in infections or in medical oncology. So the both I can see it in single specialty. So from there onwards I had interest in building it.
I am Dr. Manav. I completed my MD in radiation oncology from IMS BHU Varanasi. I secured rank 3 in NEET SS Medical Oncology. I think if someone wants to join in medical oncology and they have time, they should work in oncology also.
I am Sumanth. I completed my MD in medicine from JIPMER. I worked as SR in medicine department for 1 year. I secured All India rank 4 in NEET SS.
How did you feel about the paper?
First thing when they announced there will be a separate paper, it was like you are out of control. We don't have anything under control. Finally, like anyway, there is a exam you have to prepare. So I took it in a positive way.
I am Dr. Fazluu. I completed my MD in radiation oncology from Azad Medical College, New Delhi. I secured rank 16.
You will have some knowledge about chemo, some knowledge about onco as well, but to know the subject in depth will actually change your perspective of approaching the patient.
Yes, sir. We just knew the chemo protocol and we started. Once we were going through the Vita and the lectures which you had given, sir, so it gave us showed us that there's much more to it than just the protocols or just the chemotherapeutics or the radiation cells. So hopefully in the next 3 years we get to practice it more, so the medicine aspect of it.
Hi, I'm Dr. Ramesha CG. I've done my internal medicine from Vijay Chandigarh.
So how many hours in AIMS actually during a session?
Sir, now so I go at morning 8 o'clock and come by after having been 9 o'clock in the night. So
that is very short hours.
So 8 to 9, like morning 8 to night 9. In PJ definitely it was much longer. So it actually feels like a improvement.
So how is the preparation period?
So the preparation period was really tough, sir. It means there were some new terminologies, I guess.
So almost oncology is new to any people who is passing out of medicine.
Yes, sir. In my institute, sir, where I did my MD medicine, we used to see many cancer patients, sir. Means weekly 2 or 3, sir, in the medicine department. But those we had to refer it to the higher centers, sir. So just you would diagnose it based on the biopsy report or from the pathology section for the hemato-onco cases, sir. But then we had to refer it, sir. So I had that.
So you had only an exposure till your diagnosis.
Diagnosis part only, sir.
So after treatment is more of a theoretical story.
Theoretical story to me, sir. I haven't treated any of the onco patients till now, sir.
So your treatment is going to start now onwards. Yes. So how was mom?
She is completely fine, sir.
So she is a survivor now.
Sure, yes.
So it feels good to see a survivor.
Yes, sir. It's really.
So you're going to see so many survivors.
Yes, sir.
So to work on that is going to be really exciting.
Really exciting, sir.
Yes. And how do you feel when you get your rank? How did it feel basically? So how was the preparation period?
So the preparation period was really tough, sir. It means there were some new terminologies, I guess.
So almost oncology is new to any people who is passing out of medicine.
Yes, sir. In my institute, sir, where I did my MD medicine, we used to see many cancer patients, sir. Means weekly 2 or 3, sir, in the medicine department. But those we had to refer it to the higher centers, sir. So just you would diagnose it based on the biopsy report or from the pathology section for the hemato-onco cases, sir. But then we had to refer it, sir. So I had that.
So you had only an exposure till your diagnosis.
Diagnosis part only, sir.
So after treatment is more of a theoretical story.
Theoretical story to me, sir. I haven't treated any of the onco patients till now, sir.
So your treatment is going to start now onwards. Yes. So how was mom?
She is completely fine, sir.
So she is a survivor now.
Sure, yes.
So it feels good to see a survivor.
Yes, sir. It's really.
So you're going to see so many survivors.
Yes, sir.
So to work on that is going to be really exciting.
Really exciting, sir.
Yes. And how do you feel when you get your rank? How did it feel basically?
So first I would say that I was feeling very relieved, sir. Means at last I have there's no need of competition anywhere till now, sir.
And your exams are over.
Exams are over, all those, sir. I am feeling relieved and happy also, sir. That's the first feeling.
What were you doing during your result out?
Result, sir, I was outside, sir. I was traveling to Vizag, sir.
Right.
That's when I saw in the group that the results are out, sir.
Right.
So my mom was sitting beside me, and I was in the car. So even I can't shout also that
Yeah,
I have
true.
achieved that rank, sir.
So how did your mom feel?
So she was very happy, sir.
Right.
She was able to scream out, sir.
Yeah.
But even she also was holding her emotions right
True.
back. And then after reaching home, we were started to celebrate, sir.
Right. So the celebrations are still on.
Yes, sir.
Right. Nice. So how do you feel like from medicine to a specialty medical oncology? So where are you joining?
Sir, taken admission at TMH.
Great. So how do you feel? What is the first thing which came onto your brain, apart from your happiness of rank, when you know that it is TMH and TMH has come as a option and you have clicked TMH? So what is there a fear or a happiness, or it's a mixed?
Sir, it's a mixed reaction.
So why is there a mix in that?
Sir, the working hours, sir. And sir, like the OPDs from there and for 20.
So you heard about the work
yes, sir.
structure there.
14 to 16 hours per day work structure we have.
So still why TMH?
Sir, that is the best place to, like, sir, as we talk to the seniors who has completed the medical oncology and who are practicing, and even the radiation oncologists who are practicing, even our consultants also, sir, they said that the TMH is the place to be if you want to learn, and if you have an opportunity to get TMH, you should.
I'll tell you, one of your seniors he was again a pass out of a doctor 2-3 years back, Dr. Mehak. She has just completed probably her DM as well. Her perspective is just 1,000 days of your work, and then you are free to do your medical oncology on your own. So whatever it is, 1,000 days of your life investment is worth doing it.
Yes.
So the fear of toxicity is there, but at this age when you have clicked and you have kind of outcome so many people in your NEET, and another small toxicity, though we should not call it as a toxicity, should not matter at all.
No, sir. We're actually looking forward to it, sir. To get that opportunity to, sir, manage the things which we never got the opportunity to do in the lab.
So who is the next TMH guy here? So does that really matter again? Having an exposure during your preparation period, does that add to your preparation, or it just gives you financial help alone?
No, sir. Like being this year pattern, it definitely helps to work in a oncology ward, sir.
So why, after getting this rank in NEET, why still go and attempt INI?
So I started preparing from last year October. I finished in September. Then I was focusing on INI only. So, like I'm looking at the seniors in PJ. I never thought about NEET.
Right.
And then I joined in St. John's in January.
So preparing INI actually helped you in NEET because it's a separate specialty now.
Definitely, I have not prepared even for a single day, not even thought about NEET for a single day before the exam. So, and then I didn't expect to get rank 1 because I didn't prepare for NEET. So then I was working on the same day, like till the day of exams also I was working, and on the day of results also I was working. And after that also I was working.
Yeah.
So I didn't take that much into my mind that I got rank 1. And I
So
missed out
working
this.
is not affecting our preparation. Working has not affected your results.
Definitely.
And nothing is actually preventing you from appearing for another exam also.
Yes, definitely. Anyhow, you are going to learn.
Yeah.
That's the same mindset I appeared for NEET also. I gave medicine paper just because I was thinking if some questions come from medicine paper to INI, it's going to help you. So I was open to give INI even after my rank. And I was working in the same.
So you were attuned towards writing your INI exam.
Yes, sir. Yes, sir, definitely. Because I was working at AIMS, I was talking to.
How is the work culture there?
It's very hectic.
Very hectic. So the hectic part is there. But how does it feel when you work in an oncology ward?
So actually,
do
before
you
AIMS,
think
I worked in St. John's in Bangalore, sir. Because after like 2 months of preparation, I thought I should join after the last INI. So at that time, option was there to join in St. John's because the exam hadn't happened for AIMS, the non-accredited session. So I joined there and I met, like, they are actually my mentors. They were the nicest faculties I have met. Professor Harimenan, who is a retired, is a faculty of Tata. And then there is Dr. Annie. Both are from AIMS Delhi. So they helped me a lot. So
number of hours is not equal to toxicity.
definitely not, sir.
And so as and much number of hours that you work, you get more exposure, you get more knowledge, and kind of that reinforces your theoretical preparation as well.
Definitely. I like from September.
To you, so how do you feel a survivor is post treatment? Do they still have the fear of Any symptom will actually give the fear of a cancer.
Yes.
Do you see that in your family as well?
No, sir. Means in the initial years it used to be there, sir. But now I think it's not that much of a fear, sir. It's nearing to completion, sir. Almost of the hormonal therapy also. So, but in the initial years it used to be there, sir. Means if any new
So how
symptoms
much
comes,
does
or,
a diagnosis of a cancer impact the family apart from the patient?
sir, it is really traumatic, sir. When initial days we don't used to know about what the cancer is, what would be the prognosis. In those days, I think nearly 8 to 9 years ago, cancer would be.
So how old
taken-
are you when your mom was diagnosed?
So I was in MBBS first year, sir. So at that time it was diagnosed, sir.
So at that time, mom is diagnosed with cancer, and now you are getting into medical oncology.
Medical.
Two different scenarios
Yes, sir.
with two different mindsets. Cancer, now a survivor, now a conqueror into this world.
Yes, sir.
So how was your journey with your mother during those years?
Those years it was really means at that time, sir, I was pursuing my MBBS, so I won't used to get holidays leaves also at those was my brother was used to take care of my mother, sir, at that time when he was into his 11th or 12th class, sir. So my mother used to take treatment in Hyderabad, sir, only, sir. So at that time my brother was used to be there who used to take care, sir. At that time it was nearly traumatic only, sir, but you have to keep your mental status in a good mind, so you have to take care.
The family support
family
makes
support
a huge
makes a
difference.
huge impact, sir. Even my mother's sister or my father's brother, sir, they were all very much supportive at that time, sir. So
How much was your doctor support?
so doctor support, I would think it's matters very much, sir. Means we have to give them the hope that you would survive, because it generally instills a fear of death only, sir, initially. But when my father came to know that it was cancer, so the first question he was asking that it's an advanced stage or it is going to be cured or not. So the primary doctor was not a oncologist, sir. So when he saw the report, he told that your wife would get cured. There's no worry to means fear only. So she will get cured. So you be in your great mental status. So have
That
to
makes a difference because doctors' view on any diagnosis is going to be absorbed in toto by your patient.
yes, sir. Definitely, sir.
So your mindset about the diagnosis is more important. The way you are going to approach your patient
Yes,
is
sir.
important. The patient is going to trust you just like that for what you are going to treat them.
Yes, sir. The counseling, I think, is very much needed, sir. In the present scenarios, also the counseling which you're giving to the patient or the way we are talking to them, it should be dealt with very much empathy, sir. That's what the confidence would be driven into them, and they would have a hope that they would live, sir. And after that, that the mental status really
For
matters, sir.
other specialties, the skill evolves with so many other hand skills and stuff. But in oncology, the skill evolves with how much you change your perspective
Yes, sir.
in your empathizing.
Empathizing the patient, sir. That's definitely will matter, sir. Nearly it's a fear of death only, sir, in those days, but now it's changing. But still, the people don't know that the prognosis of the cancer would be great or bad or dismal or nothing,
the
sir.
problem is the stigma, behind the
that
diagnosis.
word, sir, or the cancer word only is the
Yeah,
is
factor.
fear factor, sir. So,
A similar incident for me only, which I'm a background of pediatrics,
okay, sir.
who I did in 2012 to 15 in Ames. And it's a day when I saw a kid with the cancer, almost on inotropes. He was just a lymphoma who got treated with some steroids, who got a diagnosis initially missed because no one palpated his abdomen initially, got steroids from an outside hospital for thinking it's a nephrotic syndrome. And he landed up in a tumor lysis to us. We never knew why a nephrotic syndrome on steroids will have a tumor lysis. Then we palpated and we saw a huge abdominal mass. Put him into dialysis. He got into heparin toxicity. So he had to receive protamine. And soon after dialysis, he had to have cardiac arrest 4 to 5 times. And every time when I gave calcium, it is like, how, am I going to lose him or am I really going to do something good to him? But beyond all this dilemma, we have to work irrespective of whatever the result is. And that is my first year posting. So after this, the next day I don't see the patient. Patient either got shifted or got discharged, no idea. 2 years down the line, I am seeing a grown-up kid in the OPD going to school. and my professor says this is the same patient whom you gave calcium. So that is a basic turning point when you get interest towards some specialty.
Yes.
Because when you are in a medicine, pediatrics, radon, whatever it is, there should be a driving point towards your super specialty. It's just not your financial gain.
Yes.
If you are doing your MD, you do get your financial satisfaction with your MD as well. So a drive towards a DM is basically a passion behind it. Everyone has some reason, and when you have that passion and when you are doing, be it irrespective of the institute, the 3 years and the work hours doesn't seem
Yes,
much to
That,
you. It actually rewards you every day.
yes, sir.
Many of you are basically preparing for at least year, 1 year.
1 year.
1 year. So when you started your preparation, how was the exam pattern?
Sir, I completed my MD in 23, sir. So that time the exam happened in September and November, sir. I don't know. But that was a medicine pattern, sir.
So at that point, did you really give that medicine?
Sir, I gave the exam. I got rank 4,000. I studied for 2 months medicine. And then I gave
So
the
there was no
No, sir.
setback. You just wanted to do medical oncology.
Yes, sir. Like I was set
So
after my first.
someone
exam.
who is from radiation background wants to do medicine just because he wanted medical oncology. So the driving factor is still there, irrespective of whatever the exam is.
Yes, sir. So I got rank 4,000, sir. I took a college. But then I thought that if I could get that rank in 2 months in medicine, I will study for some more time because NBE told that exam will be on July 25th. Sir. So I started studying medicine in Harrison again, sir.
So when did this pattern change?
Sir, pattern changed. Actually,
I mean, how long after your medicine preparation did the pattern change?
Sir, pattern changed. I think in September. I think the notification.
Yeah. So how many months of your medicine preparation? 2 to 3 months or so?
No, sir. Like it was almost like 6 months. Sir.
6 months. So that is again going to help you.
Yes, sir. Hopefully.
Hopefully. So after the pattern changes and you get the announcement as pattern change, what do you have a doubt that whether it will change again, or you just wanted to go ahead and
No, sir. Till Jan, sir, like I was very doubtful, sir, whether to stop studying medicine completely or to, if it is going to be a 50-50 paper, 40-60 paper, 60.
So that is the problem. When they change the pattern, we just get confused as to whether we continue reading or we change totally, or should we have a 50-50.
So nothing was clear, sir. They just said that it will be oncology for this. So, sir, I continued working as a senior resident in the clinical oncology setup, sir, giving chemo. I continued that till January, sir. Jan first week or second week, sir. Then I took a DocTutorials subscription when I realized that it is going to be only oncology. Studied for, sir, that 2 months, 2.5 months, sir.
So how is the mindset when patterns change? The day when you hear that the pattern is getting changed, how many questions and confusions rise in your brain?
Sir, there is no clear idea, sir, like how the question paper is going to be. We don't have a previous year question paper or anything to fall back on, sir, look at it, sir. And there is not even, sir, any QBank which is exclusively for oncology. So it was a big dilemma for a long time.
So beyond all this dilemma and confusion, someone is able to clear from a radiation background, still wanted to do medical oncology, read medicine. Then having known that the pattern has changed, he did medical oncology as his preparation. Then he's cleared that. So none of your pattern change, your change in NBA system is going to actually affect if you are determined as to what you want and whatever the pathway is given. If you have a time that which will give you some time for your preparation, yes, if you have already determined, you can take the pathway, strive hard, and you are going to see results like him.
As you already said, sir, the most important part was, sir, that the working continuously in a oncology setup.
So working is not changed again. You still wanted to work, having understood that the pattern has changed. So that has not affected your working pattern, and still the preparation was on.
Luckily, sir, I senior resident in a clinical oncology setup only. They were giving chemotherapy, and I was in the OPD setup only, sir. So that helped a lot, sir. Like by the change, I was studying medicine sideways, but I was also doing the oncology practice. So I never lost the touch of this thing, sir. So that helped a lot.
How did you feel about the paper? Good, bad, was ugly.
First thing when they announced there will be a separate paper, it was like you are out of control. We don't have anything under control. So we don't know whether questions will be asked from medical onco or radiation onco. I'm basically from medicine, so I don't know anything in radiation. So I had a fear whether they'll ask radiation onco. If so, they are asking to what depth they are going was uncertain. So I feel later they released a notice which exclusively syllabus from medical onco. They could have released it earlier, so that would have been helpful. So I was in a situation where I did internal medicine from JIPMER. So I was not feeling good that none of the questions will be asked from medicine. I was feeling like medical onco anyway, cancer patients will have complications which needs medicine support. I feel they should ask a bit questions where you will have exposure to medicine, you will have exposure to radiation also. So that was the thing. But finally, like anyway, there is a exam you have to prepare it. So I took it in a positive manner.
That makes a huge difference. The systems might change, your patterns might change. When I gave my medical NEET, so how did you feel the paper? How was the paper for you?
So the pattern, I was happy like when it changed to oncology.
So how after you are coming out of your exam hall, good, bad, or
Ugly,
extremely ugly? Right.
extremely ugly.
Seeing the results, good, bad, or ugly.
Results, I was very happy.
So, for someone who had an ugly feeling after the exam and a good feeling after the results, so just because you did not do as to your expectation during in your exam, doesn't actually change your results. That is the point from here, because everyone feels bad about how they are given the exam, irrespective of how much ever you have prepared and how you have done the exams. But if you have done the preparation properly and the exam has been given in the right way, whatever the feeling is, you will get to see your results. That is what has happened in you as well. So why ugly?
What we thought the paper will be, it was totally opposite.
What was your expectation and what was on the reality?
We were preparing for the newer drugs. Like in the group also, we were discussing all about the newer drugs, newer trials, and we were
What
focused.
is new? What is the update?
What is the update? We were like everyone was focusing on that, and we were more focusing on the like cancer solid and human part, like the treatment part. Basics were important, but after covering the basics, we were focusing more on that. But
So the time spent on basic part was there, but it was less as compared to the amount of time and amount of energy and time given to the updates and that.
yes, sir.
And then the huge paper which covers only from the basic oncology. So this brings us to the point, basic is basic and you are supposed to know the basic from the basic level.
Yes, sir. Like from the very basic level, the questions were in depth. Like
I never knew they can take so many questions from a single topic. A single question being twisted into words, the English being put here and there, and then the answers are different, and your thought process has to differ with each question.
yes, sir. Like some questions were there, like febrile neutropenia. There were around, I think, 8-9 questions from febrile neutropenia, and the language only changed. What?
So then the question, the language mattered most for you to understand what the answer could be.
And there were topics like some like AI corona score, which no one expected. Like questions will be there from those topics.
So how do you feel AI in medicine, AI in oncology will come from one by one? AI, yes, helpful or not helpful? Or
AI is
fearful?
helpful, sir.
Helpful, not fearful.
Not fearful, sir. It's helpful.
It is helpful. So it's not going to replace you. It's going to just help you in whatever.
Yes, sir.
So down the line, few years later, is it going to still be helpful or it's going to be fearful?
I think that down the line also it will be helpful only because like patient needs a doctor to like they need
touch and find
to
out.
touch and find and to talk to someone who they can trust. Like,
So the huge part of this human interaction is the trust. We were more discussing on your recall sessions than having an answer. It was more of discussion, and we did not have an exact answer for so many questions. There were dilemmas between one or the other. So it does happen in every other exam. So you might not be able to find the exact answer and what the examiner wanted, but having to have a logical thought process behind that will actually narrow down your thought process. How long are you into DocTutorials?
sir, I joined DocTutorials the next day the pattern was announced.
So that is the driving force behind joining.
Yes, like I think in October it was September or October end it was announced.
How did you come to know about DocTutorials?
I thought this is the only platform for oncology.
Right. So let us kind of publish also that is the only platform. Books apart, so book and DocTutorials or only DocT, or how did you actually prepare during your 6 months?
So for 6 months, like I seriously started preparing from Jan end. Like before that, I just used to solve QBank, and also I used AI in this. I used to just ask ChatGPT make 10 questions on this. Like during the working hours, I'll just ask ChatGPT to make.
So that makes huge point for us to inform your juniors as well. During your work hours, just not that your mobile is helpful for chatting or your social media. Trying to utilize your mobile for getting information and preparing. I mean, he said he's preparing from Jan, and basically his preparation has started right from the moment he has started searching for questions and stuff. So that is how the preparation is supposed to be. For those who want to understand when do I prepare, how much time do I spend for preparation, it is not about a defined time. We are supposed to understand preparation is in and out. When you are having a mobile, when you are bored up, there is a time that you want to relax, but there is also a time that you can actually utilize these gadgets for understanding certain concepts, trying to grab some facts and stuff. So DocT has come inside since Jan end.
Yes, sir. Like while working, I used to watch some videos. I did not complete all the videos. I was not able to complete all the videos. I watched around one third of videos.
That 1/3 also helped you in some way.
Yes, sir. Yes, sir. I did not make the notes. I think those who are preparing from now, they have time. They can make the notes and revise them. It will help. I clearly remember the things which were discussed in the class, in the lectures, were asked in the exam, but I did not revise, so I couldn't
Preparation
answer.
does make a huge difference at the end of your preparation. I think that is said in every other interview that we are doing here. Though we kind of prepare a lot, that amount of preparation time is about to be spent for your revision as well. So there is no preparation without a revision before your exam. Automatically, you know how you actually have to gamble your exams. How did the DocTutorials get into you? When and how?
I think I bought DocTutorials in January, sir, around 18th or 19th of January, sir. From then onwards, I used to watch videos. And
So that is your time before your MD exam.
Yes, I mean, so theory exams were done, sir. Practicals were yet to be done. In the Jan ending, the practicals were there, sir. And Jan 20th, I think I bought that app, sir. And from then onwards, I used to watch videos, did questions, sir. And also GTs I did in the month of March, sir. And I had also prepared for, I did the Harrison's General Onco part, sir. I was sure that I can't finish David or can't read David, sir, because it's a vast book and I
Subscription
can't.
is cheaper than a day.
Yes, sir, definitely, sir. And I feel that whenever a platform or there is a source that which is providing a crisp and concise notes or information on a specific topic, sir, you can watch that topic, and if you feel that anything extra is needed, then you can refer to a book or anything else, sir. Or else you can refer to when you are seeing the cases, or you can learn at that time, sir. I feel that that would be suffice, sir, for preparation, sir. And watching videos was helpful, sir, because you and Hemant sir would explain it in a case-to-case basis, sir. Means what to do, the next step, what can be there, sir, how the patient presents, sir, and what you have to do, how to manage those complications, sir. And as far as the exam was concerned, I thought that there would be more of systemic onco, sir. But he had been dealt with general onco only. And I remember Hemant sir saying before the exam also that you have to be doing good or revise the general onco part many a times. So before the exam, I was for the last 2 days I was preparing only for general onco, sir. I think that might have helped, sir, while doing the questions. But as far as I think, sir, it was a gimmick of a question paper only, because we were not
So
expecting
we
that
cannot
type
expect
of,
the same level of
same-
questions or similar
yes,
pattern
sir,
of
similar pattern
questions.
sir.
But being prepared for any question,
Any
paper is-
questions, sir. Because on the same topic or the common topics, they were asking 10 to 12 questions on each common topic, sir.
Top rank, but if you're getting a decent rank, then you know you are in that zone. Maybe you're missing that thing on the day of exam. Otherwise, everybody
So
will
it does put you into a pool of achievers. Whether you get rank 1 or rank 5 or rank 10 is
definitely.
dependent on how do you approach
on
on
the
that day.
exam days. Definitely, I have not got a rank 1 in any of my this thing. Maximum best I could have got is rank 3. So I didn't expect on that day. So definitely exam day.
So that is the point. When you are having some help in terms of DocTutorials and stuff, it does put you into this pool of achievers. and then it actually aids you in trying to edge over this huge competitive world. And from then your preparation, and when you're writing your exam, if you're more concentrated, you do achieve a good rank, and then the interested institute which you want. So how did you take up DocTutorials?
Sir, I was using the general medicine part, sir, for the MCQ, sir. So when they changed in November, so then I talked to the doctoral people, and they said there's a medical oncology thing coming up, and I took it in Jan second week. And since then I've been watching. I watched all the videos, the MCQs, so the general how you prepare, sir, doing GTs. Then
So how much is a book-based preparation and your work culture-based preparation? Are these videos just adding, or it helps in all the aspects?
so since I've been working, sir, so we see a lot of these papers, and so it all adds up, sir. At the final, sir, what doctoral did was like it all like, sir, there was one comprehensive cumulative like data everywhere. So I just need to like see the videos for half an hour to X speed. Like it was much easier for me. But I saw all the videos by you and Dr. Hemant, and even the sir that quick revision program. So that was for the people who are working and doing so. That was like very
So it's going to help people who are working and not finding time to kind of spend in a book and finding time to read the whole chapter. It's going to give you a concise information which is going to help you in when you are looking back your book, you're going to read in your 2x as well during your reading.
And sir, especially the hemat part, sir. Like since I'm from a radon pad, sir, I'm only focused on solid tumor. So hemat, we thought that they will ask a lot of questions. So we were scared about that. So, but they didn't ask much. But we were very strong in hemat by the video, sir, because it was so concise. We didn't have to go much back into the books to read it. Because everything was said like as it is supposed to be from the flow charts, or like how the patient presents, and it always starts with the patient presentation. So it was very easy for us. Like, doctoral made it very easy. Sir. The videos made it much easier, and the QBank was like, sir, the new QBank which was made, the 1400, that was good. And GTs, it was happening. I think 6 or 7 GTs happened. So the first GT or something I was behind. Then though started from.
So you gradually stepped up the ladder.
Because I was doing the medicine part, sir. Like, so a bit out of touch for a bit.
And now after this medical oncology exclusive, things are different.
Yes, sir. It changed a lot, sir. Like, it gave us like actually a very good. But for me personally, like I didn't read anything much. I didn't go back to my books because like all the books are huge, and 2 months is like.
It's not even possible for you when you're exiting that you have completed the book. Not as a, it's not like a general statement that you should not read. Next 3 years you're going to read as well, but it is at the end of 3 years again you feel that you would have missed a huge portion of your debut or whatever book you want.
Yes.
And concise content about all these topics will actually help you in kind of having an overview before you start reading them. So what do you want to tell your upcoming aspirants?
I just tell them, like, if they are just post MD, they are just giving exam, like, watch the videos, give the QBank, and give grant test on time. Like, give the test. Tests are the most important part, and I think solving MCQs helps, like, too, because in the exam, like this NEET we saw, the questions were very tricky. Like, if you solve more questions, you are able to eliminate at least 2 options. Then it is based on luck.
So that is more important when you're having that a limited time and so many questions. Though you might have prepared a lot, the time per question is limited, and to understand the question and what could be the answer needs an exposure and an experience with the handling of MCQs than just a theoretical background. So doing more test series also actually helps you in trying to eliminate, as you tell. And within that short time, you're able to at least concentrate on what could be the answer. So, what is your?
Actually, I took DocTutorials because one of my senior told me for oncology, it's go to his DocTutorials. So I took it during December end or Jan, some part of that. I gave INI where I got 22 rank, but it was of no use. So then I started DocTutorials. 70 to 80% I would have covered the videos. The main thing was the WhatsApp group, which was very helpful. though I was passive in that, but I could see many students posting so many things. So I used to passively learn from it, and it was like if you text Hemant sir, he would reply. If you text you, you will tell call me. So this support, I think no one offers this support. So it's more like a family which helped. So I think DocTutorials is
So the WhatsApp group, I think even Dr. Rahul Rajiv tells that actually helps so many students. It's just not the faculty questioning and that we are answering the questions. There is a interaction between the students. They ask their doubts. Because of the students raising doubts, we start learning. They themselves start searching for the answers, and it becomes kind of a group which interacts oncology before getting into. I just want to know any challenging case that you saw that you still remember. Yeah, that made my day, and that is what I'm going to remember on a long.
It's all these cases. I was happy that I was able to make that. There's one patient with I think breast cancer. She was receiving neoadjuvant chemotherapy, and she finished neoadjuvant chemotherapy. She was supposed to go for surgery, and the response PET which I have done, she had responded in all of the sites, but surprisingly, in abdomen she had got new nodes which are very big, and patient was actually not symptomatic for that. So the surgical onco people referred back. Now evaluate for metastasis. It looks like metastasis, so surgery is not amenable. But then, like I was seeing that case, I thought if it has responded in all the cases, why not this case? There must be something else. So I asked my consultant, no, there is something else using. So I asked him, he gave me the freedom to go ahead and evaluate this. I asked the patient to go to gastro, get the definition done, and I suspected maybe abdominal tuberculosis. And then with a biopsy, it turned out to be abdominal tuberculosis.
So,
and then the patient got treated, and then she underwent surgery.
so did you actually tell the patient that metastasis has happened?
No, I was.
So we have to be very careful when you're
They were
using
worried
terms.
actually. They were worried, but then I was like thinking, how can it respond in all the other things? And then only this side, there must be something else which we are missing. So I thought maybe since we see a lot of TB in PJ, so I was thinking there are a lot of cases like this which I saw that.
So sometimes that is where it is just not an equation of chemotherapy, surgery, and radiation. You are supposed to have your thought process at every point of time so that you don't miss all this basic stuff, and having given another chemo, you would have actually worsened the scenario than help the patient.
And then there was an ALL patient who was coming with fever. Suddenly her count, she was on maintenance therapy. She came with a fever of 4 days, and then suddenly I discharged in the last week, and she presented with a count of 40,000 suddenly. So thinking of relapse, how can the relapse happen in 1 week? And then we are evaluating her previous urine RME was normal. Then when we evaluated next time, she had pyelonephritis. So we stopped the drugs, and then we treated her with antibiotics. There are so many patients like this.
And this count rise is a huge fear for all these.
Yes, the patient was actually panicking a lot. And there was one more patient, primary CNS lymphoma, presenting with shock, nothing else, no fever, nothing. He presented with just shock. And then the X-ray which was done in ED was absolutely normal. And then, but the shock was persistent. Then we shifted him and then got the X-ray done. The complete lung was opacified within almost like 16 to 24 hours. Then that patient got selected. So treating these kind of patients, not just the oncology, the medicine part, you have to be open to all the diagnosis. So I think these kind of things make exciting.
I just had a patient 6-7 months ago being operated for a testicular tumor, reported as seminoma because it's from testis, and the histopathology was so clear that the pathologist was not having another doubt. They did not want a second diagnosis. Seminoma, treated, chemotherapy given, 4 cycles, very good response, but a small glowing in your adrenals. Never knew what is that. Kept on follow-up. Exactly 3 months down the line, that started growing. A biopsy again, metastatic seminoma. Again, a clear-cut diagnosis made. Second line chemo, responding, but another area it is progressing, new node. Coming to us after having Dr. shocked a lot. Again, we are doing a biopsy from the lymph node. Pathologist gives it is a seminoma again. So it's a refractory seminoma. Patient put on a combination at the 3rd, 4th line. Exactly 2 days down the line, patient goes into severe tumor lysis. As you know, germ cell tumors do lyse, and severe lung injury and liver injury post-treatment. Sepsis, shock, and neutropenia. Almost the day, and I counsel the attenders that probably we are looking at another day or two and they have signed the DIL and whatever you call it is. The next day, the pathologist calls, it's a lymphoma. Sorry, we just missed the diagnosis because of the IHC pending. So now your thought process changes. We just don't want to miss the patient. He's one day down the line where we can see another bad thing might happen. Put him on dialysis, bring him out of the sepsis, shock, neutropenia. Coming out of all, now a clear-cut diagnosis of DLBCL. All your newer treatments, able to afford, able to spend polatuzumab or everything. Exactly 3 months down the line in CR. That is the difference which you feel when you are making a right diagnosis. And though we know that we could have lost the patient 2 days down the line, when you are able to be on the track and finding out the right diagnosis, you do tend to see the differences. So from a radiation perspective, how do you look at patients coming post chemotherapy to you for radiation? Now that you are going to practice both radiation and Manav, or you are going to restrict yourself with Manav?
Only Manav.
So usually there is a sweet clash between Medonc and Radonc. Some areas it's sweet, some areas it's actually sour. But how do you, now you are going to be both? So how are you going to look at your Radonc colleagues, and what do you want to tell them after having taken Medonc?
Radoncs are the main drawback is that the setup. For me to practice a setup in my hometown or any place, like that's not affordable, not feasible for me. So like it at least costs like 40 crores for the machine itself and with the technician with the setup. And sir, it is like it's not just dependent on you, sir. You can put your brain into the pondering, but there are 100 other hands like which it goes through, and if one of them is the weakling, sir, like the whole plan which you spend for 1 week is good on the drain. So and Medonc, I think, sir, still like, sir, it's the human body. You have the at least something will work and it's on you. So that is like one of the that is one of my passion towards the Medonc. I think like I like to practice oncology, sir.
So now you are a kind of complete oncology. You know now Radonc and Medonc. And how do you feel these radiation, the post-chemo patients coming for radiation, do they really come a little down, or are you able to give the right radiation to all these patients?
Sir, the toxicities are definitely higher, sir. Suddenly like the mucositis, dermatitis, like you won't even get time to manage. So it goes from grade 1 to grade 3 just like in 1 week.
And when you are at a radiation oncologist, you would have thought, why didn't this medical oncologist just hold on that chemo a little bit? I would have actually finished my radiation on time. That would have helped the patient a lot than giving an extra dose of chemo. Now, will that perspective change after?
Sir, I think, sir, it's already changing, sir. Especially since sir, CA breast now. Earlier, it used to be very. Even when I started 2020, my consultants were very strict. Like you have to complete the radiation within the 6 month period. Now, even sir, in the last few months, even I'm seeing like even 1 year that they're giving.
That is another good thing about oncology. Every day it's changing. The previous day might look totally different, and it's not the standard of care anymore. So that is another very good thing about oncology. You tend to kind of read and understand new things every day, and that is again keeping you fresh and keeps you driving through this field, though you see so many negative things around you.
So when to consider it as a systemic disease and when to restrict to localized approach, sir, like, sir, I think that is the whole discussion, sir. So hopefully, like, sir, there will be good understanding.
Yeah, sure. So now that you have heard from all our achievers, different perspectives, different thought process. One wants a good practice or exposure during the post MD days or during the MD days. Another wants only the videos and brand tests. There are aspects which are going to help in every other aspirant. It's about you, how you take what you want. From my point of view, you are supposed to have a DocTutorials kind of an app where it can help you in one, easing your reading part. It is going to be helpful in giving you a concise part about a topic. And again, solving your MCQs helps you in actually having a hands-on experience to how you are going to face all those questions during your 3 hours of exam. So all these are important.